Welcome, ladies and gentlemen, to sqadia.com. My name is Muhammad Osama, and today we are talking about the nervous system pathologies. And in this series of lecture, in this specific lecture, we are specifically going to talk about degenerative diseases. So, in degenerative disease, we are going to talk about different degenerative diseases, such as Alzheimer's disease, Parkinson's disease, Pick disease, and others as well. So, the different degenerative diseases of the neurological system include Alzheimer's disease, Pick disease, Huntington disease, idiopathic Parkinsonism disease or Parkinson disease, which is also known as paralysis agitans, and amyotrophic lateral sclerosis. So let's start off with the Alzheimer's disease. So Alzheimer's disease is a very commonly heard name, and it is associated with loss of memory or dementia. So it is the most leading cause or the most common cause of dementia, and the dementia is progressive. It worsens with age and time. It can present either as a sporadic form, which presents at 60 years or later, which is usually age dependent, or it can also be familial, and in which case it can manifest in even the younger age, such as early as 40 years of age. So it does not have the only symptom of dementia, but it has different symptoms that can be either cognitive, behavioral, or functional. So cognitive symptoms may include memory loss or dementia, aphasia, which means inability to communicate, talk, or perceive language or text, apraxia or agnosia, in which there's an inability to in agnosia, there's an inability to perceive the sensation or the stimulus or the appreciate the different type of sensations. And in apraxia, there is failure to plan the motor activity. So there is a problem in the motor planning and the executive function difficulties because of both apraxia and agnosia, both sensory and motor deficits and motor planning deficits. Other than that, there are the behavioral signs, which include mood swings, agitation, and wandering off because of the dementia and short-term memory loss, and functional impairment, including both activities of daily living and instrumental activities of daily living, which are affected by different type of functional decline associated with cognitive and behavioral symptoms of Alzheimer's disease. It can be in serious onset as well, and there are no gait difficulties in Alzheimer's disease as compared to another type of condition, which is the Parkinson's disease, in which there is dementia as well, but there are also gait difficulties as well. So what is the etiology of Alzheimer's disease? So it is unknown, but it can be due to abnormal amyloid gene expression, which is considered as the most favored etiology for this, and inheritance of E4 allele of apoprotein E on the chromosome 19, which is found in a greater frequency in the individuals who develop Alzheimer's disease. It can also be due to the mutations in genes coding for presenilins, which is a specific type of protein, and it is associated with familial early onset Alzheimer's. So we can say that there can be familial mutations as well. Choline acetyltransferase and its product acetylcholine deficiency, and acetylcholine, as we already know, that it is a very important neurotransmitter in the nervous system and in the especially in the cortex and the hippocampus, and acetylcholine actually plays an important role in learning and memory formation, and due to the deficiency of this acetylcholine, then obviously dementia occurs and Alzheimer's disease eventually. And even in a condition in which someone is using a drug or medicine which is actually blocking the action of the acetylcholine, that can also result in a short-term memory loss. So reduction in number of neurons and neuritic plaques within the nucleus basalis of Maynard, which is actually a group of neurons in the substantia innominata of the basal forebrain, interior part of the brain, and it also consists of Alzheimer-like symptoms can also occur in trisomy 21, which is actually also known as Down syndrome. Now, what are the morphologic abnormalities of Alzheimer's disease? So one is the neurofibrillary tangles, which are actually aggregates of hyperphosphorylated tau protein, as we can see here in this picture. So this is actually the aggregates of hyperphosphorylated tau proteins. Then second is the neuritic plaques, in which there are extracellular deposits of amyloid beta in the gray matter of the brain, where the cell bodies are actually present. So here you can say that these are the neuritic plaques in the gray matter of the brain. Then we have the granulovacular degeneration, which is actually electron dense granules within the double membrane bounded cytoplasmic vacuoles, as you can see in this picture. Other than that, there can also be Hiranobodies, which are intracellular aggregates of actin and actin-associated proteins. These are actually contractile proteins, actin, which are also found in muscles in addition to myosin. And then there is generalized cerebral atrophy with moderate neuronal loss. And yes, one is amyloid angiopathy, in which there is amyloid deposits in the walls of the blood vessels in the central nervous system. As you can see, these are the blood vessels, and you can see there are these amyloid deposits in the walls of these blood vessels in this picture taken out from a microscope. Now, other causes of dementia include multi-infarction dementia, in which there is infarction in different locations in the brain. It can also be because of the alcohol encephalopathy, or Wernicke's disease, because of the alcohol can result in malnutrition, especially because of the thiamine deficiency, which can result in alcohol encephalopathy. Then there's also Binswanger disease, in which there is a subcortical leukoencephalopathy because of the leukocytes, and it is a form of small vessel vascular dementia caused by damage to the white matter in the brain, which is actually the fibers, nerve fibers, and not the cell bodies. And white matter atrophy can also be caused by many circumstances, including chronic hypertension. So increased blood pressure for a long time can also result in degeneration in the brain and can result in dementia. And as well as aging itself is a risk factor for dementia as well. And in addition to that, Pick's disease as well. So what is Pick's disease? It is also known as frontotemporal dementia. So frontal lobe, temporal lobe, so it is associated with these two lobes. And the clinical syndrome associated with shrinking of the frontal and temporal lobes of the brain because of decreased parenchymatous or the neuronal tissue. Clinical resembles Alzheimer's disease and is more common in females as compared to men. Another condition is the Huntington disease. It is a progressive brain disorder that kind of causes uncontrolled movements, poor coordination, emotional problems, and loss of thinking ability, also known as cognition. Huntington's disease usually causes movement, cognitive, and psychiatric disorders with a wide spectrum of signs and symptoms, and it commonly occurs in the age span of 30 to 40, but it can also occur before 20, and in that case it is known as juvenile Huntington's disease. Now, what are the symptoms of Huntington's disease? As we already discussed, it can have movement symptoms, movement-related symptoms, or motor symptoms, cognitive symptoms, and psychiatric symptoms as well. So, movement disorders include involuntary jerking or rhythm movements, which is also known as chorea, muscle problems such as muscle rigidity or hypertonicity or muscle contracture, which is dystonia, and slow or abnormal eye movements, and impaired gait, posture, and balance, which was not a problem in Alzheimer's disease because in that the gait was normal. Difficulty with physical production of speech and swallowing, so aphasia is also there. Cognitive disorders include difficulty organizing, prioritizing, and focusing on tasks, lack of flexibility or tendency to get stuck on a thought, behavior, or action. Preservation, so which means there's a freezing in patient, just like a Parkinson's disease, in which patient just gets frozen on a thought and he cannot progress. And lack of impulse control that can result in outbursts, acting without thinking, and sexual promiscuity because the person does not have control on his impulse, on his you can say, different type of feelings that he's having or she's having. There's also lack of awareness of one's own behaviors and abilities, slowness in the processing of thoughts or finding words related with aphasia, and difficulty in learning new information, so because of the memory problems as well. So psychiatric disorders, because of all of these symptoms, a person has feelings of irritability, sadness or apathy, social withdrawal, insomnia, which is the loss of sleep, fatigue and loss of energy, and frequent thoughts of death, dying, or suicide, which is also very common in Parkinson's disease. Now, Parkinson's disease, it's a very commonly heard of, and especially because of Muhammad Ali, which was a famous boxer, because he already had Parkinson's disease. This is also known as paralysis agitans, and it is a long-term degenerative disorder of the central nervous system that mainly affects the motor system, especially the substantia nigra of the basal ganglia. It appears clinically mostly after age of 50, so it is age-related, but the etiology is unknown. And evidence suggests that the Parkinson's disease is the product of a complex interaction of genetic and environmental factors, and it is said that exposure to pesticides and a positive history of head injury can be linked with Parkinson's disease. But those risks are modest, so it is not necessary that someone who had a head injury or is exposed to pesticides is surely going to have Parkinson's disease. So that is also why that reason, that because its etiology is not known, so it is also known as idiopathic Parkinson's disease. There are also low concentrations of urate in the blood serum in association with Parkinson's disease, and around 50 individuals with Parkinson's disease have a first-degree relative who has the disease. So there is a familial role in the development of this condition as well. So the symptoms are numerous. Specifically, there is aphasia. The person is unable to start a movement. There are tremors, as well as there is gait abnormalities and walking difficulties, and there is difficulty in initiating different movements. So specifically we talk about systemic tremor and slowness, which is also known as bradykinesia, and it can also even progress to akinesia. There's impaired balance and gait, small handwriting, sleepiness, trouble moving or walking, and masked face. And if we talk about central nervous system, there's depression, anxiety, decline in intellectual functioning because of memory and dementia as well, dizziness or fainting. And in the lungs, there's upper airway obstruction abnormalities or ventilatory control. There's weakness and aching in the muscle as well. There's constipation is also a common sign. And there's forced closure of the eyelids, and there's difficulty speaking and aphasia, excessive salivation, difficulty in swallowing, and soft or low voice, and there's increased sweating as well. So the main pathological finding or characteristic is actually the cell death or degeneration of the substantia nigra, which is actually resulting in the production of the dopamine. So there's also dopamine deficiency as well, and there's also decreased sensitivity to the dopamine as well. So there is in the treatment there is no absolute cure, but usually you can say precursors of dopamine like levodopa and carbidopa and drugs like Cinemat, etc. They are given in the management of Parkinson's disease. So it affects up to 70% of the dopamine secreting neurons in the substantia nigra when the person in the later stages or the last stages of the condition, or the when person has died when observed. And there is a characteristic presence of Lewy bodies, which are actually the accumulation of protein alpha synuclein in many of the remaining neurons, and they also are slowly and gradually become non-functional. So this loss of neurons is accompanied by the death of astrocytes, which are a type of the supporting cells of the neurons, and significant increase in the number of the microglia, which are another type of glial cells in the substantia nigra. So you can see this is non-Parkinson's, and this is Parkinson's. This is a cross section of the brain, and here you can see this is the red nucleus, reticular formation, and the cerebral aqueduct. And here you can see that substantia nigra is diminished in this cross section, and here it is very characteristically, you can observe it. at the level of the superior colliculus. And another condition is the motor neuron disease, also known as amyotrophic lateral sclerosis, in which there is a degeneration of the upper and lower motor neuron, and it is also known, includes both upper motor neuron lesion and lower motor neuron lesion. And there's a degeneration and atrophy of the lateral corticospinal tract and anterior motor neurons. So lateral corticospinal tract is a very important tract because it starts off from the cerebral cortex and moves through the spinal cord and to the muscles, and it takes the message directly from the brain to the different parts of the body. And anterior motor neurons are very important because these are the neurons that actually arise as a lower motor neuron from the spinal cord, and they move to the muscle and they give the information to the muscle to either contract or perform their function. And it results, or the amyotrophic lateral sclerosis results in degeneration, atrophy of the musculature. So the atrophy of the musculature not because of the disuse or problem in the muscle, it is because of the degeneration of that muscle which results in atrophy. So the functions include cognitive impairment and behavioral impairment. There's dysphagia and dysarthria, which means difficulty in swallowing and communicating or talking. There's respiratory insufficiency as well because of the degeneration, atrophy of the musculature. And there's muscle cramps, spasticity because of the upper motor neuron lesion, and muscle weakness and muscle atrophy because of the lower motor neuron lesion. So you can see that this is the normal. In the normal scenario, there is motor neurons of the spinal cord transmit to muscle to receive commands from the brain to the movement via the corticospinal tract. And here is the anterior motor neuron, which is taking the message from the spinal cord to the muscle and causing its contraction. But in amyotrophic lateral sclerosis, it is mostly the degeneration of the motor neurons, in which you can see either it can be an upper motor neuron lesion, so it will result in spasticity, or it can be a lower motor neuron lesion resulting in weakness and atrophy of the voluntary muscles because they no longer receive the commands from the brain or the motor neuron. So that was all about the degenerative disease of the nervous system or the neurological system, in which we talked about Alzheimer's disease, Parkinson's disease, Pick disease, amyotrophic lateral sclerosis, and other conditions as well. So I hope you learned a lot out of it, and keep on watching other series of lectures at sqadia.com so that it could be beneficial for you. Thank you very much for watching sqadia.com.